This video summarizes the article titled Clinical Features of Early Recurrence of Type I thoracolumbar intervertebral disc herniation in miniature dachshunds. There are several great images in this article, so please review the article if you are able to get your hands on it. The link is in the description. Starting with the introduction, thoracolumbar intervertebral disc herniation, IVDH, is the primary cause of neurologic dysfunction in canines. This condition is categorized into two types, Hansen, type I and type II. Chondrodystrophic breeds like dachshunds, French bulldogs, and Pekingese are most susceptible to type I IVDH. The recommended treatment for this condition consists of surgical and medical management, but there are instances of the condition recurring after surgery. Recurrence may transpire early, within 4 to 6 weeks, or late, months or years after the surgery, usually at a different site. The hardness of the disc calcification on radiographs during the initial operation is an indicator of a higher likelihood of late recurrence. Our study intends to focus on the radiographic images before and after early recurrence at the same location as initial onset in type IVDH, going through material and methods. Medical records of dogs diagnosed with type IVDH were examined, with deteriorating clinical signs within 4 to 6 weeks after surgery between June 2007 and December 2022 at Nakayama Veterinary Hospital, recording breed, sex, age, weight, neurological severity, during preoperative, postoperative and recurrence times, radiographic findings during onset and recurrence, and related intervals. Dogs were categorized into 5 groups from grade 0 to grade 5, based on a previous study, where normal gait was grade 0 and paraplegia without deep pain sensation was grade 5. The presurgical and postoperative neurological grades and diagnostic imaging results were noted. Long-term functional outcome and imaging were recorded, acquired by phone or recheck. Results of a study involving 9 miniature dachshunds are presented in Table 1. 6 intact males, 1 male neutered, and 2 females spayed were included, with a median age of 7 years, range 5 to 8 years, and a median weight of 6.3 kg, range 4.4 to 10 kg. The preoperative neurological severity grades were as follows. 1 dog was grade 1, 2 dogs were grade 2, 1 dog was grade 3, 4 dogs were grade 4, and 1 dog was grade 5. All dogs underwent radiography and myelography or CT myelography. The radiographs showed calcification at the affected intervertebral disc space for all dogs. Figures 1, 2. Iohexol 240 mg/ml, 0.45 ml/kg, was used for myelography via lumbar puncture, and CT was performed at 120 kV and 115 mA. The initial disc herniations were located between T11 and 12 and L1 and 2. A hemilaminectomy was performed to remove the extruded disc materials from the vertebral canal after the spinal cord compression site was identified by myelography or CT myelography. Post-operatively, all dogs were kept confined until discharge. There was an improvement in neurological severity grade in all dogs following surgery prior to deterioration. Recurrence of the symptoms occurred after a median interval of 7 days, range 4 to 9 days, following the first surgery. Neurological severity grade at recurrence was grade 2 in 1 dog, grade 3 in 1 dog, grade 4 in 6 dogs, and grade 5 in 1 dog. In 4 dogs, neurological severity grades were worse at recurrence than at the initial onset. Radiography of the thoracolumbar spine was performed for all dogs, revealing narrowing of the intervertebral space at the affected site at recurrence relative to the initial onset. Myelography was performed in 6 dogs, CT alone in 2 dogs, and both CT and CT myelography and 1 dog at recurrence. Disc herniations recurred at the same intervertebral site as the initial onset. All dogs were ambulatory after the second surgery, with a median interval of 3 days, range 0 to 20 days before they could become ambulatory again. Going through the discussion. Early recurrence of type IVDH after surgery may be due to residual disc materials or extrusion of further nuclear materials from the affected disc. CT scans were not performed immediately after surgery, making it difficult to assess how much disc material remained. All dogs had calcification on radiographic images before first surgery, and the absence of calcification at the time of recurrence suggests extrusion of additional nuclear materials. All cases recurred at the site of the initial surgery within 10 days, matching previous reports. Prophylactic fenestration of the affected disc space at the time of spinal cord decompression may prevent early postoperative extrusion of degenerated disc materials. Cage rest is recommended for several weeks after hemilaminectomy. 2 dogs in the study suffered recurrence before discharge from the hospital. Limitations of the study include not comparing the group against a similar population and the need for a large cohort study to verify the association between calcification of the intervertebral disc and early recurrence. In conclusion, calcification at the affected disc space at the time of initial onset is indicative of residual nucleus materials that have not yet been fully extruded, and should be noted in early recurrence of type IVDH in miniature dachshunds.